times do ambulances arrive on the site and picking up patients when in fact they're really not patients? And this is an issue that I raised on a previous date. For example, with these small fender benders, or if there's some type of an incident at the local level, whether it be something that would involve the local fire department or what have you, in many cases it's almost like a race as to who's going to get there first. And certainly that was the case in the previous format. But I'll give you an example. There's a young lady on King's Road there several years ago, and I did raise this issue. She was involved in a fender bender. She had her 2 small children with her. She was taken in the ambulance, and because both these children were preschool children, they were taken in the ambulance because they couldn't leave them in the van by themselves. They weren't treated by the emergency health services individuals because the children weren't hurt. And yet, when the bill arrived, this lady received a bill for 3 people. $1,500 for one person who needed medical service. Now, who's auditing this process, Mr. Speaker? And how many occasions have occurred throughout the province in circumstances similar to this? If the government is looking for ways to curb the cost to the people of Nova Scotia and to reduce the cost of the emergency health services to the people of Nova Scotia, then I would respectfully submit, Mr. Speaker, this is one avenue that the government could probably do a little more auditing of what's going on with its contractual relationship with EMC. Another example, Mr. Speaker, is with regards to the air ambulance service. There was great fanfare, Mr. Speaker, that the government would save millions of dollars by taking over the operation of the air ambulance service in the province of Nova Scotia. It wasn't good enough that the private contractor who was providing that service was doing a good job for a reasonable fee. The government, in its wisdom, whether it be at the bureaucratic level or the political level or both, made the decision that they could save money by bringing this in-house. Well, Mr. Speaker, till this very moment, they have not provided one shred of evidence that they would save 1 penny. In fact, Mr. Speaker, they are spending more money for the taxpayers of Nova Scotia by doing what it's done. They said in the first year that the cost, the kickoff cost or the startup cost will be a little higher. I believe they were estimating somewhere in the vicinity of around $2 million. But what they didn't mention, Mr. Speaker, all those pieces of real estate that were donated in good measure, and all the benevolence, all the money that was raised through different charities and trusts from companies in Nova Scotia that contributed millions of dollars to help support that system. All those charitable donations have dried up. They've dried up, Mr. Speaker, and there's not a whisper from the Minister of Health as to why we're spending more of the people's money to provide a service that was provided cheaper when it was provided by that private contractor. And I'm at a complete loss as to why the government doesn't seem to want to address that. Now, it's been at least going on 3 years since that issue was put on the table. And the government, at the time, gave an undertaking at the budgetary process that those savings would be realized in the future. We haven't seen any evidence of that. And I would respectfully submit, Mr. Speaker, that the government is critically remiss on that particular issue because, Mr. Speaker, you need buy-in from the community in many of these rural communities, whether it be out in the Eastern Shore, out in Jador, the head of Jador, whether it's down in the valley, whether it's down in Digby Neck, whether it's down in the northern tip of Cape Breton, or what have you. But, Mr. Speaker, there's been considerable loss of buy-in from the community because of this government action. So yes, while I applaud the government for bringing this legislation forward, the government is very quietly and very calculatingly gouging the people of Nova Scotia for every penny it can get through user fees. What about other user fees, Mr. Speaker, in the healthcare system? What about all the other medical testing user fees that have been implemented in the last fiscal year? How much money was realized by the government on that particular issue? And yet there's not a whisper. The government is saying, we have a surplus. We have a $40 million plus surplus. The debt is growing, Mr. Speaker, at a rate of what, $125,000 or $40,000 an hour? And the government says it has a surplus, and we're doing great. How can we be doing great if the debt continues to grow, Mr. Speaker? So we have to ask ourselves, with all that money that's coming from Ottawa, tens of millions of dollars every year, when you add it all up, I'm sure, since this government came to power, we must be looking at close to $750 million a year, more than they had when they started. Certainly, cumulatively, there had to be a significant amount of money. And yet the government, when it went into power in 1999, said it was going to correct all the problems in healthcare for $74 million. Now what happened, Mr. Speaker? What happened that we can introduce pieces of legislation like this that do provide some corrective measure, but yet when we see orders in council through the regulatory process, for example, in April of 2004, these rather significant fee increases to the users of the healthcare system, and not a whisper. Not a whisper, Mr. Speaker. And why not? Because it's very popular. It's a populist action on behalf of just about any provincial government to attack the federal government. They got the money, they got what they want, and still they're gouging the people of Nova Scotia. And with the spin doctoring, they're trying to make everybody believe that things are wonderful. We're doing wonderful. We got a surplus. But how much did the debt grow in the last year? We can't afford to muse about tax cuts. We can't afford to play games. Yes, we did, on the premise that they were going to do something good. But I tell you, Mr. Speaker, the sun comes up tomorrow, and the leader of the NDP should know that as well. He should not be too confident in how he struts his feathers, let me assure you. That's right. Even on cloudy days, the sun comes up tomorrow, Mr. Speaker. Well, some members of the NDP caucus are living in a fog anyway, so I'm not going to bother going that route, whether the sun comes up or not. So I'll leave the honourable member for Dartmouth North provide his own thoughts on this particular piece of legislation. Well, Mr. Speaker, it seems like not many seem to be engaging in rather lively debates in the House here the last few days, so we thought we'd certainly liven it up, and make the people of Nova Scotia realize, you know, this cloak and dagger approach that the government has to the management of the people's money, and how this particular piece of legislation will impact on the people of Nova Scotia. And what do we get from the government benches, Mr. Speaker? Absolute silence. Absolute silence. They won't say anything, they won't do anything. They're just hoping that this House will just kind of open and close with a whisper. Let's not say too much. Let's not do too much. We don't want to make too many waves, because we've got a rather interesting and unique situation coming up in March, April of 2005. So we have to brace and prepare ourselves. But Mr. Speaker, I would ask the government, particularly the Minister of Health, to provide some detail on what happened with this air ambulance service. Where is this saving that was supposed to be realized? Why is it that we had to increase user fees by 20%? in the last budget. Why is it? I mean, the government obviously feels that that was a necessary item to put forth. And yes, Mr. Speaker, members of the opposition did provide some qualified support to that. But I think time has come for the government to explain itself. You know, I was absolutely amazed, Mr. Speaker, last Friday when the Minister of Health was musing about another tax cut. Well, so was the Premier. The Premier threw cold water on that within an hour. He realized that this is like a death trap. Let's not go there. So the Minister of Health is now looking for that $40-some million for his budget. The tens and the hundreds of millions of dollars that he got from the federal government wasn't quite enough. You know, he's quite cavernous over there. You know, and Mr. Speaker, I think the government owes considerable explanation. Waiting times was a big issue. And with increased usage of ambulance services in the province of Nova Scotia, Mr. Speaker, obviously that's going to put more pressure on outpatient services. And certainly, Mr. Speaker, I know of individuals just in the last week would go in with cuts to their face and their hands and so on, and have to wait as many as 4 to 5 hours to receive emergency service because of the backup in the system. And that's no reflection on the healthcare workers. That's no reflection on the nurses or the doctors or what have you, because they're doing their level best. And I can attest to the fact that any time our family has ever required health care service, Mr. Speaker, it's been top-notch professionalism, and they do the level best with the resources they have. But it's not always a question of putting more money at the problem, and the minister has recognized that. He's taken some corrective action to deal with some of the problem at the QE2. But what's the follow-up? That's only a one-year Band-Aid approach, given the fact that he put extra money there. But what about the other regions of the province? What's happening there? You know, it's not quite good enough to say that we're going to hobble from one crisis to the next in a Band-Aid approach. So yes, Mr. Speaker, legitimate arguments have been made on the issue of funding from Ottawa with regards to the fact that Ottawa may or may not be paying its fair share. And I'll support the government on that. But if they're only paying 17, maybe 20, 25% with the latest announcements on the cost of health care, then the federal government, through the CHST, must be paying somewhere in the vicinity of 90 to 95% on community services and education, because it all comes in one envelope. So what the provincial government is doing, Mr. Speaker, is they're moving dollars around out of this envelope. They're stacking the money on one side of the equation to make it look much worse on the other side, because what's the most important issue to the people of Nova Scotia? Their health and well-being. So which issue would you like to make the federal government look the worst and deflect attention away from your own inadequacy? Health care. And the Premier, who said he was going to correct all the problems for health care in 1999 for $74 million, not only went in, Mr. Speaker, and spent that $600 million health care investment fund that was established in the budgetary process, which the NDP so graciously voted against, but then they supported it on a future day. So, he's in retirement, so I don't want to go back. Mr. Speaker, rabbit tracks. I would invite the honourable members, the Tory backbenchers, to get up and speak on this particular piece of legislation. It's a very important piece of legislation. So it impacts not just the ground service, it impacts on the air service, it impacts on the emergency healthcare services, outpatient services right across this province. The minister knows that. The Minister of Finance certainly knows that, because I'm sure he's been tapped on the shoulder from the left and from the right looking for money. But I really do believe that we need an airing on these user fees. And perhaps when the Minister of Health is closing in second reading of this bill, Mr. Speaker, he will have an opportunity to offer his definition of a user fee. Because we have 3 definitions on the floor of the House of Assembly so far from 3 different ministers of the government. And I would be interested to see if a 4th definition would probably bring us closer to the true definition of a user fee. So, Mr. Speaker, I don't want to belabor the points that I've made, but I think on the general principle of the bill, we have no problems with it. I certainly don't. I know my colleagues have raised their concerns, local issues. I could go on and raise many of the issues on health care throughout rural Nova Scotia, but I think most members of the House know that at this point. So I'll conclude my remarks and allow for another speaker to raise some other points as well. Thank you, Mr. Speaker.
Recognize member for Dartmouth North.
Thank you, Mr. Speaker, and it's a pleasure to have the opportunity to speak on the Emergency Health Services Act, Bill 117. I have to say that I don't intend to speak a long time on this bill, but I do want to say that this is a bill that is long overdue, and I would echo the comments of other colleagues of this Legislative Assembly. I also want you to know that, in fact, that the emergency services, health services that are provided to Nova Scotians are, as recorded, some of the finest in North America. And as a matter of fact, we have to recognize the contribution that Dr. Ron Stewart, who was a pioneer and the Minister of Health at the time, with respect to bringing forward this kind of emergency health services to Nova Scotians. And what was most important today, as I said in the legislature, Mr. Speaker, like many days you said in the legislature, you listen to people of differing expertise and differing fields of profession. And today I heard from my colleague of Halifax-Cobequid, whom in fact was an emergency health services employee, who in fact, Mr. Speaker, played the contributions to this community by being that health services employee and providing the services to make sure that Nova Scotians received the emergency services necessary. He spoke very eloquently about the role of the first responder, whom I really didn't have a real picture of whom the first responder might be. I anticipated that it might be fire services and so on, Mr. Speaker, but now I do know that one of those first responders are the first ones on the scene of the accident, no question about that. But primarily, most often it is not the policing services, because the policing services is not equipped with the kind of devices and necessary medical aids in order to assist individuals. However, the fire department in its role does that as a first responder. The fire department, being very well followed by the ambulance service, carries out a tremendous job in the province. And we all know what happened prior to the ambulance service in this province, when in fact it was owned by most often funeral directors and individuals who had funeral parlors across this province, who picked up the individuals and took them to the hospital, providing they survived once they got there. That was a question, Mr. Speaker. So that's right. So they had the opportunity, Mr. Speaker. The bottom line is this: those days are far advanced from today in providing the level of services that Nova Scotians really need. So we know the level of services here today. And Mr. Speaker, I want to say that it's because of this bill that I stand up and speak, not primarily with respect to the level of service that we have, but one that many other members of this legislature got up and spoke about, and that's the issue of user fees. It's a very important issue. User fees. I'm sure that every one of us in this Legislative Assembly at one time or another has written emergency services because citizens or constituents could not pay the emergency fee. They came to us and said, what are we going to do? and the constant fear that they will not get the emergency services if they don't pay this bill. And there needs to be a message sent out loud and clear that, in fact, if you don't pay this bill and you're unable to pay this bill, that you will not be denied emergency services. Because there are people out there whom, in fact, believe that they will not get that. And that's a fact, Mr. Speaker. And there needs to be some clarity with respect to a note or an indentation on the bill that individuals won't be denied emergency services as a result of paying this fee. The fee of $125 may seem such a small fee for such a great service to many of us. But there are many Nova Scotians who earn incomes of less than $20,000 a year, whose $125 fee is a matter of having food on the table or a drug to purchase. And when we have the emergency ambulance service fees, then we need to know how those fees are justified. And Mr. Speaker, through the regulations, I do believe where fees are structured and set, that there will be a formula that will justify the increases or the fees charged to emergency ambulance services in this province. This, Mr. Speaker, is significantly important. It's significantly important to every Nova Scotian, regardless of where they live in this province. And many Nova Scotians who live in rural communities do not have access to, in fact, clinics, healthcare clinics, and so on. They have to take that ambulance service to their nearest hospital. And that, Mr. Speaker, is a fact that costs them money every time they do it. And I have said earlier, it's a fact as well that they do not have those kind of financial resources to met out their dollars in a way that, in a way that will allow for ambulance service fees. So there needs to be some clarity with respect to that. And often you will get a letter back from the emergency health services saying that, look, the fee has to be paid. The individual, we can make arrangements with the individual to set up payment fees. What is the good of setting up a payment fee for an individual who cannot afford to pay the fee in the first place? It makes absolutely no logical sense to use the administrative time and paper to send it out to an individual and cost Nova Scotians to an individual whom you know full well cannot pay the service or the fee. And there needs to be, Mr. Speaker, a careful consideration around this piece of legislation that adds a clause that would allow for special individuals to be exempt from user fees. And as well, Mr. Speaker, there has been some talk with respect to the clients who use the ambulance service. For example, I had a client who came into my office here in June of this year. And the client who came into my office said, look, Jerry, all my health services and all my medical records are at the QE2 across the bridge in Halifax. And when the ambulance service came to pick me up, the distance was equally the same except for the token fee. When they came to pick me up, they drove me to the Dartmouth General Hospital, which eventually sent me off to the QE2 Health Science Center on Summer Street. Now, Mr. Speaker, I don't know what the logic of that is, but I will say that, in fact, I did write the emergency health services, and I forget the name of the gentleman, and I must say that he sent me back a very nice letter indicating that there is some flexibility with respect to that movement, providing that, in fact, the client informs the emergency health services that, in fact, there is a real need, and the only kind of special services that can be provided are provided at the QE2 Center. Something to that effect. I don't have quite the logical phrase or the language with respect to what the letter has stated, but I do have a copy of the letter, and I must say that the client in this particular case was receptive and supportive of the response back from EMC with respect to this move. But it's something that many Nova Scotians don't know. They don't know what to expect when they have an emergency vehicle pull up to their door, an ambulance pull up to their door. They don't know if because of zone they're entitled and recommended or suggested that because this zone, and I can understand you can't have ambulances running everywhere, but because of this zone that you're taken to the nearest hospital in that zone. Even though it might be the equal distance to an institution or a hospital that you have already have your medical records and everything there. They have a history of you and everything. There's no need for to drive you to one institution, medical institution, and then to another. Mr. Speaker, and I do know that, it's just a matter of time and information can be transported via the communications of satellite and so on by way of computer and drafted into another hospital or whatever. It's a matter that takes time as well. And it's a matter of having the services that you're accustomed to and the environment that you're in as well when you enter an institution. I must say that in my period of time, have had to use the ambulance services of Nova Scotia approximately twice during the years. And I have to tell you that each time that I've been in need of those services, that it was a professional service that came to my door. There were top-notch individuals who fully understand and knew my particular ailment at the time, and knew approximately, I should say not say approximately, but knew how to adjust my particular need until I arrived to the hospital in order to get the full-fledged services. It's a long way from the time that I first used an ambulance service when I was a young individual, Mr. Speaker. I can tell you that. And today, when you enter into one of these professional mobile units with the professional staff, you know that you're in the care of, you have the quality care delivered by the best qualified Nova Scotians. And I can fully understand why we are rated across this province as having that kind of a system. And once again, Mr. Speaker, we can provide accolades to those who first started it up, but we also must give credit to those who continued to make sure that the services were enhanced. And you can't have an enhanced service without an additional cost or without additional monies placed into it. That doesn't mean, Mr. Speaker, that there's no need to justify the additional dollars, to scrutinize, to evaluate, and assess. Rather, we're getting the real bang for our buck, as we constantly use that phrase. I will say, in closing, Mr. Speaker, that I will be looking forward to this piece of legislation because of the number of parties who were involved in this piece of legislation and their input. I'll be looking forward to this piece of legislation crossing the legislative floor into the red room over there and watching or listening intently to the kind of input that will be provided by those who come to speak before it. But I must say, Mr. Speaker, I am not in anticipation of a large number of individuals coming in to speak against this piece of legislation. Primarily, if anyone comes in, they will probably be speaking in support of this piece of legislation. Once again, I want to commend my honorable colleague from Sackville-Cobequid for providing the enlightened information to me as the role and responsibility of an EMC employee. And also my honorable member from Halifax-Needham, who is a health critic who has often followed the cost of emergency health services and the performance of emergency health services as well. So with that, Mr. Speaker, I will give up my time. Thank you.
428. Recognize the honourable member for Halifax Fairview.
Thank you, Mr. Speaker. Mr. Speaker, we are really blessed to live in a province that has one of the best ambulance services, not just in Canada, but in North America. The statistics that are shared across North America by ambulance services show that our service is second to none. We have one of the best on the whole continent. We are blessed to have a thoroughly professional corps of paramedics and 911 dispatchers. The system is run excellently, but it comes at a cost. You don't get a Cadillac service for nothing, and we are paying more on a per capita basis than most other jurisdictions. That's the trade-off. If you want to have a truly first-class service, then you have to pay for it. And that choice has been made. That choice was made by the last Liberal government, as my colleague, the member for Dartmouth North, has said, under the leadership at the time of the Minister of Health at the time, Dr. Ron Stewart. The somewhat chaotic system of ambulance service delivery was consolidated and brought together in the form that it presently is today, where it's delivered through one provider who provides 98% plus of ambulance services in the province. There still are one or two very small providers, Mr. Speaker, although I understand that even those are being consolidated into emergency health services. So then, Mr. Speaker, I have to ask myself, why is it, how is it that in a province with such a first-class ambulance service that we cannot get our act together on billing and fees? Why is it that in a province which is second to none in North America, we can't even get the government to face up to the fact that there are serious problems with ambulance fees? There are serious problems on which the government has done nothing less than stonewall, where they have met the concerns raised by me and my colleagues in the NDP caucus, and they have greeted them with silence. They simply won't deal with them. It's not like they're saying there's no substance to them, Mr. Speaker. What they're saying is that they will greet it with silence. They will ignore it in the expectation that eventually the problem will just go away. But the problem is still there, and it affects every single one of us in this House, because every single one of us have constituents who need an ambulance. And what most Nova Scotians don't know is that if they call an ambulance, or if an ambulance is called for them, they could get stuck with a bill which is unfair or unreasonable, and there's not a thing they can do about it. Mr. Speaker, this whole story goes back to when ambulance services were consolidated in the 90s. And a piece of legislation was passed early on, but it was shelved in 1994. It was passed all the way through this legislature, but never proclaimed. And so, strangely enough, we have had this world-class ambulance system being operated without any statutory authority whatsoever. A strange position to be in for a government-provided service costing tens of millions of dollars a year. No statutory authority whatsoever. And the Auditor General, in his 2000 annual report, pointed this out to the government. He said simply that there is no statutory basis. He reminded the government there's no statutory basis for the ambulance service, and just as importantly, there's no statutory basis for the system of fees. Nova Scotians are being charged tens of millions of dollars a year with no legal authority to do so. And this first came to my attention, Mr. Speaker, as a member of the Legislature's Public Accounts Committee. And I was taken aback at the idea that the government could extract, and had been extracting for a number of years, so much money from Nova Scotians with no legal authority to do so. And I raised it with the government, but met with my first experience of stonewalling, where the government just refused to acknowledge there was even an issue. So, Mr. Speaker, what I did is launch what I call the Ambulance Fees Challenge. On March 13th, 2002, I held a news conference with 7 Nova Scotians And we said that we were refusing to pay the ambulance fees until the government took them to court and proved that the bills were legally valid and fair. 7 Nova Scotians stepped forward with their cases in full public view and said, we will not pay these bills unless the government takes us to court and has a judge confirm that there is legal authority to do so. Mr. Speaker, and it came to my attention in the course of the research that I did of 6 specific instances where the ambulance fee system is simply unfair. And let me get the first straw man out of the way right away, Mr. Speaker. It is not my position, it's not our position, not now and never has been, that there should be no ambulance fees. Most ambulance fees in Nova Scotia are reasonable and fair, and Nova Scotians should pay them. But there are 6 specific instances where the fees are unfair. And the government, 2.5 years later, still will not deal with it. And I want to, Mr. Speaker, tell this House more about what those 6 specific instances are, because this bill institutionalizes an ambulance system which is founded on this billing system, which is unfair. The first one has been referred to by a number of people. My colleague from Pictou West referred to a case involving his own parents. The member for Cape Breton West may have been the first one to raise an ambulance fee case in this House, certainly the earliest that I remember, of 3 people, a mother and 2 children in an ambulance, and each one of them gets billed the full amount. Triple billing in that case. Double billing in the case raised by the member for Pictou West. If it is justified to charge $600 for an ambulance ride arising out of a motor vehicle collision, how can you justify charging $1,800 simply because 3 people are in the ambulance at the same time, whether they need to be cared for or not? How can you justify even double billing? So, Mr. Speaker, that's the first instance that the government refuses to come to grips with, the unfairness of double and triple billing. If the ride costs $600, it costs $600. And having total bills arising out of the same collision of $1,200 or $1,800 cannot be justified. And I think it's significant, Mr. Speaker, the government has never tried to justify it. They simply tried to deflect attention from the real issue. Secondly, Mr. Speaker, is just besides the double and triple billing is the very fact that there is a special rate for cases involving a motor vehicle collision. For an ordinary ambulance ride, the fee is $120. But if a motor vehicle is involved, it's $600. What's the reason for the difference? Well, the rationale is that it's covered by your auto insurance. And it's covered by auto insurers out of a special fund that means that the rates, the premiums should not go up if you put in your claim. But the government has not acknowledged, will not acknowledge, refuses to acknowledge that that's not the way the world actually works. That's the theory, and the government just keeps going back to the theory, but it's not the way the world works in practice. Because of this, Mr. Speaker, auto insurance companies offer to many of their customers what they call a good driver discount. So what they say is your real premium is up here, but we're going to discount you because you've got a record of being a good driver. And what happens if you put in an ambulance claim is not that your premium goes up, but you lose your good driver discount, which has exactly the same effect. Nova Scotians don't care why their rate's going up. The dollars out of their pocket are going up. And technically, their premium's not going up. All that's happened is they've lost the good driver discount. But the government refuses to acknowledge that that's actually the way the insurance industry works. And whenever I raise this issue, they raise a smoke screen, Mr. Speaker. They say, well, that's not supposed to happen, but it does happen. And they say I'm talking about subsidizing insurance companies, which I'm not. They say that what I want to do is reward bad drivers, when that's exactly the opposite of what I'm talking about, because the Nova Scotians who end up paying for this are precisely the ones who are the best drivers because they have a good driver discount. And I have never heard the government yet, not the former Minister of Health, not the present Minister of Health, not anybody, actually address this issue. They throw up the smoke screen as if that answers the question, but it doesn't go away when you throw up a smoke screen. It's still there. Mr. Speaker, the third aspect of the ambulance fee policy that is unfair is that if an ambulance is called because there's been an accident that's compensable under the Workers' Compensation Act, the bill is for the full so-called insurance rate of $600. And that's because the theory is that it's being paid for by the Workers' Compensation Board. And I cannot seem to get it into the government's head that that is not what happens. The Workers' Compensation Act says specifically that if there is an accident at the workplace and an ambulance is called, liability for the bill rests with the employer, not with the Workers' Compensation Board. But whenever I raise this, the government says it's paid for by the Workers' Compensation Board. It's not. It is not. It is not. It is not. It is not. And I just wish one time I could get somebody on the government side of the House or in the civil service to acknowledge that fact. And it's the small business owner who really gets hurt by this. Because if the government acknowledged that there was no insurance company behind them, the rate would be $120. And I think that's something that employers can swallow, some more easily than others. What they can't swallow is a $600 bill based on a false premise, namely that somebody else is paying it. But they're not. Certainly, Mr. Speaker.
Chester St. Margaret's on the introduction.
Speaker, I very much take a great privilege to have this opportunity to introduce two people in the Speaker's Gallery. And they are indeed the Colin MacDonald, the President of Clearwater, and Peter Matthews, who is the Vice President of Clearwater, and certainly not just on the South Shore. That company is very, very important to all sorts of people in Nova Scotia. We just ask you people to get up, and we hope you enjoy the House.
Thank you. We certainly welcome our special guest to the gallery today and hope they enjoy the proceedings. The honourable member for Halifax Fairview has the floor.
Thank you, Mr. Speaker. So that's the third kind, the workers' compensation situation, which the government refuses to address. The fourth one is that if a Canadian from outside Nova Scotia needs an ambulance, the bill is for $600, not $120. Now you may say to yourself, well, what's wrong with that? If a tourist comes in and gets in an accident, why should we pay for their ambulance fee? And there's a certain amount of justice in that. But the world's not that simple, Mr. Speaker. We have many people who may have a health card, say from Ontario, but to all intents and purposes are residents of Nova Scotia. I could mention students, for example, or Nova Scotians who've been in another province and have moved back and are now living here permanently again. It doesn't matter, as long as they have a health card from another province, they get dinged the out-of-province amount. The province will not consider the individual circumstances. The province says to these people, well, just make a claim to that other province and they'll pay you. And the government of Nova Scotia refuses to recognize that the world is not that simple and that very often that other province will say, no, we don't pay for that. So the theory behind it is that $600 is an appropriate fee because the taxpayers of the other province are picking it up. The reality is that that is not always the case. And there are many Nova Scotians who get dinged with the out-of-province rate even though they're resident here. And it's not fair. If there's an issue to be determined, that's an issue between governments about how to settle claims for each other's citizens. But what we in Nova Scotia do is we put those people right in the middle of it, and we make it their responsibility to fight with that other province. And we make it their responsibility to pay, even if the other province says no. And the government refuses to acknowledge that that can happen and does happen. And similarly, Mr. Speaker, the fifth case of unfairness that I've tried to bring to the government's attention over 2.5 years, if that a person lives in Nova Scotia but is not a citizen or permanent resident of Canada, they get dinged the out-of-country rate, which is $900. Now, you may say, Mr. Speaker, well, that's fine if a tourist comes in here from Britain or Italy or South Africa or Japan or wherever and they get hurt, there's no reason for the taxpayers of Canada to pick up the bill. And that's true, Mr. Speaker. But the problem is when somebody has moved to Canada permanently, has moved to Nova Scotia permanently, they may have lived here for several years, they just don't have their status yet. They may be a refugee. But because they don't have their status, they get dinged with the out-of-country rate just as if they were a tourist. And it's not fair. It is not fair. It's not right. It's not reasonable. Many of these people, especially if they're refugees, have come to this country with nothing. Nothing. They're the poorest of the poor. And if they need an ambulance, they get dinged with a $900 bill. And the government refuses to acknowledge that that happens or refuses to acknowledge that it's a problem. Finally, Mr. Speaker, is the problem raised by my colleague, the member for Dartmouth North. And that is that there is no allowance in the billing policy at all for need, medical necessity, or inability to pay. It is the policy of EMC and Emergency Health Services that no debt will be forgiven, no matter how extraordinary the circumstances, no matter how poor the patient, no bill will be forgiven, and that the only thing they will consider is a payment plan. They say, pay us $5 a month. Whatever you can pay, pay it, but we're not going to forgive it. And Mr. Speaker, we have people like Ann Hudick of Dartmouth, who's one of those test cases, who regularly needs an ambulance, is too poor to pay for it. And so she just, over the years, has just piled up a bunch of bills that she can't pay, has no hope of ever paying because her income can't cover it. And there's no provision whatsoever in the billing policy to deal with it. And the government refuses to acknowledge it's even a problem. Now, Mr. Speaker, I might feel differently about this if I felt that the government had heard what we're saying, understood what we're saying, and could offer good, solid policy reasons for not changing the policy. But that's not what they've done, Mr. Speaker. That's not what they've done at all. The government response, rather than dealing with these things, has been quite different. Their first response was to retroactively change the law to legalize ambulance fees. Okay, so they acknowledge at least that they never did have the legal right to charge the fees, because a couple of years ago in the Financial Measures Act, as part of the budget, they passed an amendment that gave them the regulatory authority to set fees. And they said it was retroactive back to the year 2000. So neatly covering any of the test cases. So that's the first thing they did. Now, retroactive legislation is never a happy thing, Mr. Speaker, because what the government does is it reaches into the past and deems the law to be different than it actually was at the time. But that was under a majority government that clearly felt it could do whatever it wanted, could command the votes to do whatever it wanted, and did command the votes to do whatever they wanted. So they dealt with the issue of illegality, at least, the illegality issue raised by the Auditor General with a retroactive change of law. They still have not dealt with the issue of fairness or reasonableness. I've raised this issue over and over and over again in this House. I've raised it in question period, and I've raised it in estimates debate, and at every opportunity I've had, as I'm doing again today, Mr. Speaker, I've raised this issue because I'm not going to go away on this issue. I'm not going to give up on this issue, Mr. Speaker, because the unfairness stays the same. The government hasn't even touched the billing policy. The minister, the former minister especially, and to a lesser extent the current minister, generally had 4 responses, which were all ways of throwing up dust, ways of not dealing with the real issue. The first one which a favorite of the department, is to say, well, there's an appeal available, Mr. Speaker. Well, there is an appeal available, but it is absolutely beside the point. There's no question that in some cases, EHS makes a mistake. Somebody is billed who shouldn't be billed. They're billed for something they shouldn't be billed for. And that's what the appeal system is for. And, you know, Mr. Speaker, in my experience, it works reasonably well. If the person knows that the appeal system is there, they'll have their case heard, and if a mistake was made, it'll be corrected. That's my experience. But the existence of an appeal system is absolutely no answer to these problems I'm raising. Because what the appeal system does is decide if the policy was properly applied. It does not deal at all with whether the policy itself is fair. So, for example, a refugee who's dinged with the out-of-country rate at $900 can appeal all he or she wants. It won't do them a bit of good, because the policy is that a refugee pays $900. So it's not like the policy has been misapplied, it's the policy itself that is wrong. And the appeal system is not empowered to change the policy. So the minister's first answer is irrelevant, but it's a favorite of the department. The second one I've dealt with already, that we're subsidizing insurance companies. That's not at all what we're doing, not in the least, Mr. Speaker. In fact, quite the opposite. What we want to do is really stick it to the insurers when there is an insurer there and make sure that they don't pass it on to their policyholders in the form of getting rid of good driver discounts. But that's what they do. That's what they actually do. And I've given the department real-life cases where that is clear that that's what would happen, is that if the person submits the bill, their insurance, the amount of out-of-pocket premium they pay, will go up higher than the amount of the bill. I've given the department names, dates, numbers, names of insurance brokers that will confirm it, and they still refuse to acknowledge that it will happen. Mr. Speaker, the third thing the minister does, past minister especially, and the current minister to a lesser extent, is to talk about the excellent service provided by EMC and emergency health services. And it's true, but it's just beside the point. It's just not the point at all. The excellent service provided by our dispatchers and paramedics and everybody else associated with our world-class ambulance service have nothing to do with the billing. In fact, paramedics will tell you that whenever a question of billing comes up, it's really a pain for them. They don't want to deal with it. It's not their business. But people will raise it with them. And paramedics will tell me that they've actually advised people getting into ambulances not to pay their bill, because that is the only way to put their mind at rest. It's not the paramedic's job to get involved with the government's billing policy. That's done in the back rooms. That's done in the background, just like in any other service delivery organization. The delivery of the service is one thing. The billing and collection is something completely different. So, Mr. Speaker, if the minister says we have an excellent service, I'm with them all the way. I'll sing in the same choir as him on that one. But it absolutely evades the real question about the problems we have with ambulance billing. And the final thing that the former minister did, not the current minister, thank goodness, was to attack me and say that the problem is me, that I'm a lawyer. It's so cheap and easy to say, oh, he's just an ambulance chaser, Mr. Speaker, which that minister has done. He says in question period, Mr. Speaker, I should turn off my scanner, Mr. Speaker, and that's okay. Mr. Speaker. Mr. Speaker, that's okay. The minister can attack me if he wants to and say that I'm the problem. I'm only the voice for the problem. I'm only the person who stands up in this House and relays to the government what the problems are. Okay? And if the government chooses to deal with this issue by attacking me, that's fine. They can do that. But they still haven't dealt with the real issue. Because, Mr. Speaker, the people, this is about the people, and the people who are involved in the ambulance fee challenge and the people who have contacted me about it come from all over the province. And believe me, Mr. Speaker, they come from every riding represented in this House, or very nearly so. And if anybody thinks it's not a real issue, let me put you in touch with somebody in your constituency who thinks that it is. So, Mr. Speaker, what I'm looking for is the government taking these billing issues seriously. And I met with the leadership of EMC, Mr. Moore, a very fine gentleman, an excellent administrator. I really have a high regard for his ability and what he's done over at EMC. I met with him at the EMC offices in Bedford, and I raised these issues with him directly. And he was a bit taken aback, I have to say, Mr. Speaker, because what he thought I was coming to tell him was that there should be no ambulance fees. So he extolled how great the service is. But I had to correct him, Mr. Speaker, I have to say. I had to tell him that's not what I was there to say. And I patiently went over with him again the correspondence outlining the 6 specific instances where the ambulance fee policy is unfair. And he said he'd get back to me. And he never did. He said he'd raise it with officials from the Department of Health. Well, if he did, Mr. Speaker, I wasn't informed of it. I have no idea what the outcome was. So, Mr. Speaker, the department has referred the entire matter to their departmental lawyers. Because I said to them, Mr. Speaker, I said, if you want these people to pay their bills, you're going to have to take us to court and prove that you're entitled to do so. Mr. Speaker, and here I guess is essentially the point. 2.5 years ago, on March 13, 2002, I stood up with 7 Nova Scotians and said, we will not pay these bills until you take us to court. And over 2.5 years later, the government has done nothing to collect those bills. It is in the hands of the departmental lawyers, and every time the issue comes up, the lawyers say, well, we're still intending to do something with it. They've been saying that for 2.5 years now, Mr. Speaker. It's clear, Mr. Speaker, and the message that I want Nova Scotians to get about ambulance fees is that if you refuse to pay your bill, if you put your foot down and say that's not fair, the government will drop it. They won't collect. Mr. Speaker, that's the message. If you don't want to pay your ambulance fee, then don't. Because the government appears to know that it hasn't got a leg to stand on. Because if it did, Mr. Speaker, the court case would be over and done with. This is a small claims matter. Each and every one of these cases is under $1,000. All they need to do is take us to small claims court and prove they've got the right to collect the money and get the small claims court adjudicator to say, yep, it's fair, it's reasonable, no problem, here's your judgment. But they haven't done it in 2.5 years, Mr. Speaker, and I think that's a shocking message for the government to send. Because they're not dealing with the real issue. They've managed to make these 7 cases go away, or so they think, by ignoring them. But these were only test cases. These were only a sample of the people who approached me. When a short newspaper article appeared in early 2002, I was contacted by dozens of people, literally dozens of people, from one end of the province to the other, from side to side, from all over the province, and I only picked the 7 cases that I thought best exemplified the problems with the billing policy. So if you don't deal with those 7, which that is the government's apparent strategy on this, is to ignore it, what about the others? What if I say to them, don't pay your fees? What if I say to other Nova Scotians, don't pay your fees? What's the government going to do? Are they going to ignore the next 7 cases? Are they going to ignore the next 70? Are they going to ignore the next 700 cases? Mr. Speaker, because if that's what it takes to get the government to face up to the unfairness of the ambulance fee billing policy, I'll do it. So the matter is in the hand of the departmental lawyers who tell me that if I have anything to say to the department about this, it's got to go through the lawyer. And the lawyers, then it goes into the abyss and I never hear from them. I don't hear from anybody from the department. I don't hear from the lawyers. I don't hear anything. All I know is that the 7 people who stood up that day and said they're not going to pay their bills have never paid their bills. And the government hasn't even attempted to make them. Now, what does that tell you, Mr. Speaker, about the ambulance fee policy in Nova Scotia? What does that tell you? I know what it tells me. It tells me that the government knows it hasn't got a leg to stand on. The government knows that beyond these 7 cases, that it doesn't have a legal case to make these bills stick if people fight. Mr. Speaker, it tells me that the government would rather try and stonewall on this issue rather than actually deal with it. Because all I'm asking for is very simple. Mr. Speaker, all I want is very simple. I want either the Minister of Health or a departmental official to sit down with me and look me in the eye and tell me why these issues that I've raised are best dealt with by ignoring. I want somebody to sit down and tell me, why this is fair. Why is it fair that a refugee is charged $900? Why is it fair that a small business owner is charged $600 on the fiction that the Workers' Compensation Board will pick it up when we know that the board won't? Why is it fair that when a mother and 2 children get into one ambulance, that the total bill for that family is $1,800? Why is it that when a Nova Scotian can prove that their auto insurance rate will go up if they submit the ambulance bill, that the government will not acknowledge that fact and charge them the full insurance rate? Mr. Speaker, I want somebody to look me in the eye and tell me why that's fair. I don't want them to raise these other smoke screens they've raised, like the excellence of the service, or the fact that I'm a lawyer, or the fact that an appeal is available, Mr. Speaker, or that we're subsidizing insurance companies, or that we're trying to give a break to bad drivers, all that nonsense that the last minister repeated over and over again. Because, Mr. Speaker, when you repeat something that's not true, that doesn't make it true. And that's something I do not understand. In my entire time in this legislature, Mr. Speaker, of 3.5 years of raising a number of difficult issues, either in this House or directly with civil servants, all that work that MLAs do in their offices, which is the part of the iceberg, that nobody ever sees. They see what we do in here, but they don't see that most of what we do is out there in our constituency offices, Mr. Speaker. I do not understand. I've never seen the government deal with another issue this way. I've seen the government disagree with me, which is fine. That's the nature of the business. They don't have to agree with everything I say, Mr. Speaker. I have never seen on any other issue the government stonewall the way they have on this issue. I have never seen them try and deflect the real issue by raising straw men and then knocking them down. I have never seen another issue where the government will not come to grips with what I'm actually saying. Why are they doing this, Mr. Speaker? I don't know. But whenever this kind of thing happens, whether in political life or elsewhere, whenever I see somebody refusing to deal with the real issue, I know that somewhere, somehow, part of the answer is that they haven't got a leg to stand on. And they know it. And the only way they can deal with it is by deflecting attention from it. It's not going to go away, though. But it's not going to go away, Mr. Speaker. It's not going to go away. And as long as I'm in this House, I'm going to raise this issue, Mr. Speaker. And whether that means until the next election, or the one after that, or the one after that, I'm not giving up, Mr. Speaker, on this issue. And if the voters of Halifax Fairview decide that they want to retire me at the next election, that's their prerogative, Mr. Speaker. But as long as I am here, Mr. Speaker, I'm not going to let this issue go away. I'm not going to let this issue go away. I want to see the Minister of Health actually deal with this issue head on, Mr. Speaker.
Just because you repeat it doesn't mean it's true.
So, So let's now get to this bill. Okay, so this bill is supposed to, it's a very peculiar bill for one thing, Mr. Speaker, because what it does is not about something that's going to happen in the future. The government's trying to legalize something that they've already done. This is something they've been doing for years, and now they're trying to put a legal framework around it. They managed to dodge the issue a couple years ago in the budget by putting an amendment to the Health Services and Insurance Act. And isn't it amazing that you could have an entire bill on emergency health services and leave out any mention of billing? I don't think that's an accident, Mr. Speaker. I think it's another step in the government's attempt to evade dealing with the real issue. How can you have a bill dealing with emergency health services and not talk about how it's paid for? Not even mention in the bill how it's paid for. Not even mention the tens of thousands of ambulance bills that go out to Nova Scotians every year to pay the cost, which is over $30 million. How can you have a bill that doesn't even mention that? Well, it's because the government knows this is unfair and doesn't want to deal with it. So, Mr. Speaker, what I would like to do is repeat my call, which I issued on March 13th, 2004, the second anniversary of the Ambulance Fee Challenge, which is to invite Nova Scotians who have a problem with their ambulance fee to not pay it. Contact me. Lots of information about how to do it is available on my MLA website, www.grahamsteele.ca. Click on ambulance fees, and you will see everything you need to know about this issue, Mr. Speaker. Because I want Nova Scotians to know that the 7 people who stood up and drew a line and said, "We will not pay our bills," have never been forced to pay. I want Nova Scotians to know that. If you draw the line, the government won't push you. Now, Mr. Speaker, I'm not saying that everybody should go out tomorrow and not pay their ambulance fee. Most fees... no, that's not what I said. See, Mr. Speaker, Mr. Speaker, the old former Minister of Health is up to his old tricks again, Mr. Speaker. And, Mr. Speaker, I think that former minister, Mr. Speaker, has done just about enough to spread smoke screens and misinformation about this issue, Mr. Speaker. I don't think we need any more out of him, Mr. Speaker. On my website, Mr. Speaker, I explain in detail which cases I think are appropriate and which ones are not. The things that Nova Scotians should take into account when they're deciding whether or not to pay their ambulance fees. And for those who missed it the first time, it's www.grahamsteele.ca and click on ambulance fees, Mr. Speaker, and people will find all the information that they need to make a thoughtful decision on whether their situation is appropriate for not paying their fee. If they believe that it is, after reviewing the information on my website, Mr. Speaker, I invite them to speak to me, as I will be only too happy to take their case to the Department of Health, Mr. Speaker. Mr. Speaker, we have one of the best emergency health services in North America. In North America. And why is it that all this talent and ability can't be turned to making the fee policy fair? Mr. Speaker, why is it that the government has spent so much of its time over the last 2.5 years trying to avoid dealing with the real issue? Why have they handed the issue over to the departmental lawyers who for 2.5 years have done nothing? Who won't communicate, Mr. Speaker, about what the government's intentions are? Mr. Speaker, why is it that whenever this issue is raised, the government raises misinformation, not real information, but misinformation about what's really going on? Why is that happening, Mr. Speaker? And just in case any of the members think that this issue may not be relevant to them, I just want to review where some of the people live who took part in the ambulance fee challenge. I mentioned already Ann Hudick from Dartmouth, Selwyn Welsh of Windsor, John Marknett of Halifax Clayton Park, Alana Kessick of Truro, Matthew Johnston of Sydney Mines, Trevor Willis of Middleton, Jason Shreenan of Westville. And Mr. Speaker, I believe that of those 7 cases, the only one that's been resolved to date, I believe I'm right in saying this, is Jason Shreenan of Westville, because EHS acknowledged that they made a mistake to bill him in the first place. Mr. Speaker, just so you know what happened in that case, Jason was in a motorcycle accident and a passerby took him to the hospital. And when they suggested at the hospital that he would be more appropriately dealt with at the larger hospital in New Glasgow, the passerby offered to take him there. But they said, no, we'll call an ambulance for you. And so they took him from the smaller hospital to the Aberdeen in New Glasgow, and the family was shocked to receive a bill for $500, Mr. Speaker, because it was essentially a voluntary taxi ride. I think EMC has acknowledged that that was an error in procedure and Jason should never have received that bill in the first place. But the government has never acknowledged that any of those other cases is wrong. There is another person who's been added to the test cases, and that person is from Antigonish, Mr. Speaker. There are also dozens of other cases, and I'd like to read some of the circumstances, Mr. Speaker, so we know what we're dealing with here. Collection letters sent to children, repeated collection calls being made to a person who EMC had been told repeatedly was under mental disability and had a legal guardian. And the one, Mr. Speaker, that I find most heart-wrenching, and I've spoken about it in this House before, and that was the case of the elderly couple in Dartmouth who took an even more elderly mother out of the nursing home, the one along the Purcell's Cove Road, because they felt that the care she was receiving was not appropriate. And so they took her out, and they discovered that night. I want you to picture this, Mr. Speaker, if you can. 2 elderly people with an even more elderly mother of one of them at home. And they realized that night that her care needs were far beyond their ability to deliver. They couldn't lift her. They couldn't move her. They realized that despite the problems they had with the nursing home, that she needed to be back in the nursing home because the nursing home could provide better care even under the problematic conditions that they'd identified than they could in their own home. And very tearfully, they were told that the only way to get her back to that nursing home was via ambulance. And because it was classified as a non-emergency call, they were billed $500. And that was before the fee went up, Mr. Speaker. Now it's $600. I mean, where's the human understanding here? Where's the acknowledgement that life doesn't always fit into neat categories, and that sometimes things happen that don't fit neatly in this box or that box or that box, and that there are circumstances where there needs to be some judgment? But that family, who were trying to do their best by their elderly mother, were billed $500 because returning her to the nursing home was classified as a non-emergency call. So it wasn't even the regular rate of $120. It was or at the time it was $100. It was $500 for two pensioners, Mr. Speaker, and the government won't even acknowledge that there's a problem. So where does that leave us, Mr. Speaker? We have a bill on the table dealing with emergency health services. Yeah. As my colleague from Sackville-Cobequid says, maybe it's 10 years too late. They're trying to retroactively legalize something they've been doing for years. But they still won't deal with the issue of fees, Mr. Speaker. And I don't know what to do with this bill, Mr. Speaker, because if holding it up is a way to deal with it, to get the government finally to acknowledge that there's a problem now that they don't have a majority anymore, well, I'm willing to do that. I don't know if the Liberals are willing to do that. I know that the member for Victoria the Lakes has raised an issue that he wants dealt with. The member for Cape Breton West was one of the first ones in this House, even before I did, to raise ambulance fees issues in the House. And I know other members from other parts of Nova Scotia. The member for Glace Bay, I thought, gave a very eloquent speech on the problems in Glace Bay.
Don't get carried away
But how far are we going to go with this? I don't know. That it doesn't depend just on us. It depends partly on the Liberals. But there's more of us over here than there is of you over there. And if I can persuade the Liberals that some of their issues need to be addressed, and that we can address them together before this bill moves forward, well, I'll do my very best to do so. Now, I have to admit, Mr. Speaker, that in the past, I haven't always been as nice as I could possibly be to the Liberals. Sometimes I have some fairly harsh things to say about the Liberals, Mr. Speaker. But there are times, especially in a minority government, when we all have to consider what's in the best interest of our constituents. And this is a case where, Mr. Speaker, where there's more of us than there are of them. And if the Liberals believe that there are issues like the one raised by the member for Victoria the Lakes that need to be addressed, well, this is the time to do it. This is the time to do it, Mr. Speaker. Because I want the minister to understand that ignoring me again is not going to make me go away on this issue. And the former Minister of Health did his very level best to ignore me, Mr. Speaker. Well, I'm still here. I'm still standing. I'm still raising the same issue, and I'm going to keep raising it until it's dealt with. Mr. Speaker. And so with those few words, though, I think we all have some questions about how this bill is to proceed in these circumstances. Thank you, Mr. Speaker.
Recognize the Honourable Minister of Health. We close debate in Bill number 117, the Honourable Minister of Health.
Thank you very much, Mr. Speaker, and it was an interesting afternoon. Mr. Speaker, I first of all want to, the Honourable Minister of Education was reliving some memories, he said. Mr. Speaker, first of all, I want to thank members for their participation in the debate. One of the things that I'm often asked, Mr. Speaker, honourable members would know that I was in this House in a previous time, and members are very often interested in what's different about the place now compared to what it was like then. And Mr. Speaker, I can feel reasonably confident that that this afternoon's debate would have been much shorter than it was in a previous time, because the interpretation of the rules were quite different in that time than they are today. The matter of fees is something that's dealt with under the Health Services and Insurance Act. The principle of this bill is a bill that gives to the Department of Health the legal authority to enter into contracts for the provision of service, for the setting of standards, and for the method of meeting those standards and evaluating the standards. That is what is dealt with in the principle of this legislation. The principle of 95% of the debate that took place here this afternoon is the principle of another bill, the subject matter of another bill. So, Mr. Speaker, I'm saying that in a previous time, I believe that the interpretation that would have been accepted, and it's not at all meant as a reflection on your decisions this afternoon, Mr. Speaker, because I believe you're reflecting a collective pool of thought that is quite different today than it was in a previous time. I point that out. The real issues, Mr. Speaker, are the provision of emergency health services in this province, providing the Department of Health with the legal authority to enter into contracts and to set standards and ensure that those standards are met. That's the real issue that is before the House this afternoon, Mr. Speaker. And I particularly want to express my concurrence with the members who spoke of the excellent service that is provided by the ambulance service in this province, both by the administration through its organization, the manner in which it is constituted, and of course by the individuals, both those who provide the the medical service, the paramedics, and those who are involved in the dispatching throughout this province. We're extremely well served, and it's appropriate that honourable members made reference to that this afternoon. I want to. There are, in as much as the matter of fees was part of the debate this afternoon and the discussion, Mr. Speaker, I want to remind honourable members that the level of fees that are charged in this province are not at all inappropriate. If we look next door to our sister province, New Brunswick, the amount of the fee is $120. PEI charges $130. If you were to go to Manitoba, Mr. Speaker, which is governed by the New Democratic Party, they charge a fee of $190 plus a kilometre charge, Mr. Speaker, in that province. And if you go further west, Mr. Speaker. If you go further west, Mr. Speaker, the charge is $275.
Order, please. The Honourable Minister of Health has the floor.
The honourable member for Cape Breton South. I'm sorry, the honourable member of Cape Breton South further reminded me, of course, that Saskatchewan is a New Democratic Party government as well. But the fee in that province is $275 plus a kilometre charge. And in addition, Mr. Speaker, there is a $75 charge for inter-hospital transfers in that province. So, Mr. Speaker, the fees that are charged in this province are appropriate. And so in terms of the amount of the fee that is charged, Mr. Speaker, we are well within range. The cost of...
Order, please. Order, please. The Honourable Minister gave his attention when the members were speaking. I asked to give him the same consideration. Honourable Minister of Health. The Honourable Minister of Health.
Well, Mr. Speaker, Mr. Speaker, Nova Scotians are well served by the ambulance service that's in this province. They are well served in terms of the quality of the personnel that provide that service. They are well served in terms of the organization of that service and how it is delivered throughout the province. And they are also well served with respect to the level of fees that are charged for the provision of that service within this province, Mr. Speaker. I've demonstrated that it is clearly within a reasonable range relative to other jurisdictions throughout this country. Mr. Speaker, reference was made to the charge with respect to multiple persons being carried in a singular ambulance. The fact that we all must recognize is that the charge is not, unlike the situation in Manitoba and Saskatchewan, is not for the ride or the distance of the ride. The charge is for the service, Mr. Speaker, and the service is provided by the paramedics, it's provided by the doctors, it's provided in part by the vehicles that are used to carry that, and of course all of the equipment that is employed within it. In the same way that the charge for service within the hospital, whether it's one bed in a room or two beds in a room or three beds in a room, Mr. Speaker, that service is provided, that charge is provided for the service that is provided within the hospital. And that service is made up of the medical personnel, the nurses, all of the people that are involved in the diagnostic services within the healthcare system. So, Mr. Speaker, we are not talking about a charge for a ride or a distance. We are in fact talking about a charge for a particular service. Back, Mr. Speaker, to the principle of this bill. I'm pleased that members seem to indicate that it's appropriate for the principle of this bill to be accepted and move forward, and I look forward to further stages in the debate. Thank you, Mr. Speaker.
Motion is for second reading of Bill 117. Is the House ready for the question? All those in favor say aye. Counterminded nay. Motion is carried.
Bill 117, title and act respecting the provision of ambulance services and emergency health services.
Order this bill be referred to the Committee on Law Amendments. The Honourable Government House Leader.
Mr. Speaker, would you please call Bill number 115, the Maritime Provinces Higher Education Commission Act.
Bill number 115, Maritime Provinces Higher Education Commission Act. The Honourable Minister of Education.
Thank you, Speaker, and I'm delighted to rise at this time to say a few words about an act respecting the Maritime Provinces Higher Education Commission. It's interesting, I guess, that this bill is coming on the floor of this legislature following the bill from my colleague, the Minister of Health, because like the bill that was just debated in this, on the floor of this House, this one has been around for some years too. I hope in this session, Mr. Speaker, that we will be able to deal with it expeditiously and move on. So my remarks are going to be brief, Mr. Speaker, unless I get encouragement to speak longer.
I resisted, Jamie.
Mr. Speaker, I want to talk just a little bit about the Maritime's Higher Education Commission. It's been around for a long time, but in 1997 its mandate changed. And there was a memorandum of understanding signed by Nova Scotia, New Brunswick, and Prince Edward Island, which was to redefine the role of the Maritime Provinces Higher Education Commission, and it was agreed that at that time the three provinces would pass legislation simultaneously so that the legal basis of how the Maritime Provinces Higher Education Commission is operating would be established in each of the jurisdictions. For one reason or another, it did come on the floor of the House here, and anyway, it didn't go through the final process, so it's back again today. In essence, what the bill does, it legalizes or will give a legal authority. It will recognize in statute how the Maritime Provinces higher education has been operating for about 6 years. Once the Memorandum of Understanding was signed by all three provinces, then the Maritime Provinces Higher Education Commission began operating under its new mandate. So this particular bill is cleaning up something that could have been cleaned up some time ago, but for a variety of reasons was not. As I said, the major change in 1997, and we have colleagues on the other side of the House who were here at that time, and they would know about this, is the Maritime Provinces Higher Education Commission had really 5 functions at that time. One was the quality assurance of academic programs. In other words, if a university in the Maritime Provinces wished to make a significant change to a program or add a new program, then they submitted a proposal to the Maritime Higher Education Commission, who said, yes, it meets quality standards, or it doesn't. Secondly, along with the quality, through the Maritime Provinces Higher Education Commission, particular programs and universities can be reviewed to see that quality is maintained over the course of time, and that would be a periodic thing. Secondly, the Maritime Provinces Higher Education Commission has a statistical data collection portion and function, and it collects and disseminates data and information which goes back to the institutions and to the three governments to enable decision making. Now, Mr. Speaker, I hate to use a prop, but there was a report that everybody got today that came from the Maritime Provinces Higher Education Commission, and I just want to hold that up as an example of the types of No problem. Okay. I would table that, Mr. Speaker, but I believe everybody has a copy. But that talks about the impact of family education background on success in university. So it does that in addition to gathering enrollment statistics and graduation statistics, and it also does some needs assessment about where we need programs and things like this. Thirdly, it does urge cooperation among maritime institutions. And for example, we have veterinarian medicine over on Prince Edward Island. We have medical education and dental education here in Nova Scotia. They've got forestry education in New Brunswick. And there are a variety of things like this where it really makes the population and the provinces are better served if there is a coordinated and agreed upon location for programs where you get a critical mass so that you can have excellence. And the fourth thing is, Mr. Speaker, that it does today, and it did back in prior to 1997, is that it administers the funding programs of the regional programs. For example, we in Nova Scotia pay Prince Edward Island for the seats in the vet school. And that money, Nova Scotia will pay the Maritime Provinces Higher Education Commission, who will transfer that money to PEI. Similarly, the island in New Brunswick, when they send students to our med schools, they pay for those seats, and that money goes through the Higher Education Commission and comes here. So it has that function. There are other examples of that too, Mr. Speaker. Now, what I want to really do now is to really draw the distinction between the new Maritime Provinces Higher Education Commission and the Maritime Provinces Higher Education Commission prior to 1997, when that memorandum understanding was signed. Really, it's really a pretty minimal change, but a very significant one. Prior to then, the Maritime Provinces Higher Education used to make recommendations on the funding of higher education to the individual provinces. In other words, the research basis and recommendations for how much money should be given to the universities, the higher education institutes in the maritime provinces. There was a recommendation from the MPHEC. The fact was, Mr. Speaker, at that point, although those recommendations were made by the Maritime Provinces Higher Education Commission, each province more or less did as they thought they could do. So effectively, that role of the Maritime Provinces Higher Education Commission, despite that they were spending a whole lot of resources on it, producing a good report, it really wasn't of any great significance. So in recognition of that, the provinces got together and said, we're each going to make our own funding decisions. Let's remove that role from the Maritime Provinces Higher Education Commission. Mr. Speaker, with those few comments, I will move the second reading of this bill.
The honourable member for Timberley Prospect.
Thank you, Mr. Speaker. And it's good to see this piece of legislation, I guess if we could say it, see the light of day again. Because as the minister has noted, that when I receive something that appears on my desk from the Maritime Provinces Higher Education Commission, immediately it attracts my attention, because this particular group is in a position of some influence. It's in a position of some power, and it is an influence and power that I think provincial legislators have to pay more and more attention to. Now, when I look at the developments that have taken place since '97, and when I look at the fact that we are now, of course, in 2004, I think it's appropriate that we very clearly lay out, as this piece of legislation does, clarify some of the important things of the modus operandi when it comes to the Maritime Maritime Provinces Higher Education Commission. So I'm certainly looking forward to Bill 115 moving through to law amendments, because it does clarify a number of really important things. It clarifies that nominating process in an open and transparent way. And that is something that I think is of real significance when we look at this commission and how it operates and how it will continue to operate, and how the provinces bring forth people who will serve on this commission. And that is a tribute to the people that have drafted this piece of legislation. It's a process, it's open and transparent, and it's something that the members of this caucus are certainly going to be willing to support. Also, I think it's a real consequence to clarifying the duties, and in particular, of course, the tabling the audit of the finances of this important commission. These are some of the very progressive things that are included in this piece of legislation, and this piece of legislation, I'm sure, has been well thought out and will be well received, and when it goes to law amendments, of course, it will be of some significance to see what the stakeholders are saying about this particular piece of legislation. I want to compliment the Minister also in very clearly designating the difference between prior to 97 and now the current operations. I think it's very important that we understand, based upon the Memorandum of Understanding, when we look at such things as the quality standards, when we look at the review of programs, when we look at the statistics and the data collection, which is so important when we look at this important institution, or when we look particularly at the cooperation that's urged and the importance of looking at this program regionally. And those will be some of the comments that I will be making for a few moments now, because one of the significant factors is in the Maritime Provinces, we often very closely look at just what is happening in isolation at Antigonish at X, or in Charlottetown at UPEI, or in Sackville, New Brunswick at Mount Allison. And of course, and I know the member from Glace Bay will probably speak on this matter, when we look at what is happening at UCCB and some of the developments that will be happening in that university as it grows and expands with the legislation that is in front of us. And I encourage the member from Glace Bay to speak on this particular matter, because it's that sort of cooperation and it is that sort of leadership that this commission can bring forward that is best for all of the post-secondary institutions in our region. And you know, Mr. Speaker, that's one of the things that many times we miss in this particular east coast of Canada. We think of Prince Edward Island. We think of New Brunswick. We think of mainland Nova Scotia. And of course, because of the current situation at UCCB in Sydney, we think of the Cape Breton situation. And I think it's really important to look at the cooperation. We look at the cooperation with the forestry program at UNB, and how students from Nova Scotia who want to be in a top quality forestry program, the place to go is to the University of New Brunswick. I find that difficult to say sometimes, Mr. Speaker, considering the university I went to, but it is the place to go. That is the institution that is recognized and has the quality of standards in that particular program at UNB. Or the other prominent example, of course, is the example of the Veterinarian College at UPEI. In fact, previously, one of the reasons that UPEI has the Veterinary College is that that particular institution expanded its horizons, moved beyond the St. Dunstan's and Prince of Wales College experience, and have, through their efforts, had the opportunity to have the Vet College at the University of Prince Edward Island. And then, of course, we look at the post-secondary institutions here in Halifax Metro. We look at the dental schools. We look at engineering. But that encourages cooperation and the mobility of the students who, in most cases, have an undergraduate degree and are going to be moving on to graduate school. The Maritime Provinces Higher Education Commission has an important mandate to fulfill. It's a mandate which I'm looking forward to hearing more of at law amendments, and it is something that at this stage, as we move on in debate, I thank the Minister for bringing it forward, and I'm looking forward to supporting this legislation as it moves through the various stages of our House. Thank you, Mr. Speaker.
Thank you. I recognize the member for Kings West.
Mr. Speaker, I'm pleased to rise and speak on this bill today. And certainly, Mr. Speaker, as a former educator, I know the importance of the work that the Maritime Provinces Higher Education Commission does on an annual basis, and the significant role that it plays. Now, since 1977, the Commission has been working with the other maritime provinces to provide our students and universities with sound advice and research. And one of the most meaningful aspects of the Commission's mandate, Mr. Speaker, is the research and subsequent reports produced by the Commission. Now, a good example of such a report was just 2 weeks ago when, of course, it was reported that the results of research that suggested students from lower income families are beginning to attend university at a lower rate than those from more affluent families. And I was at the release of that document, and certainly that was one that I find very disturbing. It is out of the tradition that we have had here in Nova Scotia, where students from all socioeconomic groups have that opportunity to go to university, because we know when they go to university that they achieve and accomplish at the same level as students who do come from more affluent and homes where parents are well educated. So, Mr. Speaker, research like this is vital to government if it is committed to making post-secondary education accessible then to all students. We are pleased, Mr. Speaker, to see the mandate of the Commission renewed and refocused through this legislation, and this will better reflect the current activities of the MBHEC. The passage of this bill, which has already assented to in PEI in New Brunswick, will allow legislation to be coordinated and proclaimed in all 3 provinces. And certainly that kind of cooperation is most significant and perhaps more necessary than ever before. As we know, resources are very stretched, and it's important that we do not duplicate the efforts, whether we're talking about research, approving new programs, or dispensing funding among institutions. Even looking at ideas such as a central registry certainly is one possibly whose time has come. So it's particularly important to students who make their academic choices based partly on the information available.
Order, please.
Through the
Too much noise in the chamber. To ask the members that they have to talk to please go outside. And singing, no. The Honourable Member Kings West has the floor.
There's no question, Mr. Speaker, that this kind of research provides analysis that helps students plan for their futures. And because the Maritime Province's Higher Education Commission operates at arm's length from government, it helps to ensure students receive quality programming through the monitoring carried out by the Commission. The Commission also plays a vital role in terms of accountability by informing the public of the state of post-secondary education in the Maritimes. And of course, generally speaking, we know that currently is at a very, very high level as we compare our institutions to those across the country. Although, Mr. Speaker, we are supporting this legislation, our caucus wants to reiterate the importance of including students in some of the discussions that are directly related to their education and the costs of their education. Government is currently working with university presidents on a memorandum of understanding, and student leaders have told us that they often feel excluded from these decisions that affect their education. And so we wanted to bring that to the attention of the House. These outcomes will have an impact on students, and most significantly, the results of these discussions will affect tuition these students pay in the future. As a result, our caucus feels that more effort has to be taken on the part of government to incorporate students into these kinds of discussions. Mr. Speaker, we are pleased that the mandate and role of the Commission is going to be laid out in legislation, because the Commission does very important work, and the legislation will ensure it has the authority to continue that work. Students rely on that work to help them develop their future academic and professional plans. Nova Scotians rely on the Maritime Province's Higher Education Commission to provide the facts of the state of post-secondary education in the Maritimes. And with that, Mr. Speaker, our caucus will certainly be supporting this bill at second reading and look forward to its arrival at the Law Amendments Committee. Thank you, Mr. Speaker.
Thank you. I recognize the Honourable Member Cape Breton West.
Thank you, Mr. Speaker. They say brevity is the hallmark of a good speaker, so I'll try and be as good a speaker as I can. You know, some of my friends would agree with that, and some of my friends would disagree with that, and of course I agree with my friends. But Mr. Speaker, this particular piece of legislation is, as my colleague has suggested, is a good piece of legislation. it will accomplish a number of issues that have been on the table for some time. Also, I see it as an opportunity to flag a number of issues with the minister with regards to education, and particularly the cost of university education for the students in Nova Scotia. I was somewhat disappointed to read an article in the Winnipeg Sun just several weeks ago. It was dated a little more than a month ago, August 29th, 2004, and I'll table it, Mr. Speaker. And the headline says, "Cost Cutter Campus." And it went on to lay out the cost of education, university education, for each province in Canada. And disappointingly, Nova Scotia is reported to have the highest cost of tuition in the country. And I hear the government House Leader saying that's not true, but I will table this. And if the figures are not correct, it's an opportunity for the government to take issue and table before the House information that would suggest otherwise, because the 2004-2005 estimated university cost by province, they had Newfoundland at the lowest at $10,949, and Nova Scotia the highest, $16,943. And I'll table that particularly for the interest of the Honourable Government House Leader. But Mr. Speaker, the question I ask is, what can the Higher Education Commission do to help alleviate this concern that's becoming a major obstacle for the young people of Nova Scotia to secure a post-secondary education? And I'm not so sure this particular piece of legislation speaks directly to that particular matter, but in a number of different ways, I'm sure that it does. One of the good things I've seen in recent years, particularly through the 90s, was the fact that the different universities came together and cooperatively started to refocus and reshape their efforts so that they would achieve not only success in maintaining the high standard of education in different programs, whether it be the BEd program, whether it be in some of the science programs or what have you, but I noticed one of the accomplishments that I thought was moving forward with some considerable trepidation at the time was that selected universities would focus and use certain programs as their major focus of attention in educating students. For example, the BEd program. That's if you think of the BEd program today, you think St. FX University, you think Mount St. Vincent University, and perhaps several others. And myself having not been acutely aware of some of the detail, that demonstrates that what they did is they became more efficient in the delivery of service, and the competition between universities providing the same programs and actually putting themselves in a disadvantage at the end of the day was addressed. And I think that's a testament to the leadership at those various levels. But another issue as well, Mr. Speaker, is not only the high cost of university, but the effects of this high cost of university, because many students that leave university today, if they're fortunate enough to be able to stay in university, is they're leaving with considerable high debt loads. Some of them with student debts, loans of anywhere from $40,000 to $60,000. And that puts them in a very disadvantaged position, particularly if they're looking for a startup in some career that will afford them an opportunity to not only pay back their student loan, but obviously to start being able to start a career where they can pay their own personal bills, buy a home, probably perhaps start a family, advance their professional opportunities or what have you. So that is a major issue. And I'm not so sure what the Higher Education Commission can do to address that. Obviously, the bill speaks to certain aspects of that. But, Mr. Speaker, one of the disturbing trends that I've seen, particularly has been noted with reference to the University College of Cape Breton, obviously perhaps soon to be renamed, is the fact that I've seen many students who have to go and secure a student loan, in fact, are fortunate enough to have a student loan approved, which for the most part will allow them to be able to pay their tuition for the first half of the year. And perhaps some of their costs, their startup costs, the books, all the other miscellaneous and student costs that are associated with their traveling costs, because for the most part, the University College of Cape Breton is a long-distance university. There are very limited seats for student residents, and most students that attend that university have to travel. They have to use different modes of transportation. The high cost of fuel has made it extremely difficult for many of these universities to cope. And the set fee, the schedule of fees for transportation costs for those universities is fixed and hasn't been adjusted for a considerable amount of time. Just the increase in fuels alone has more than gobbled up any opportunity to be able to, or any benefit that would allow them, for example, to be able to travel from September to December. Well, now they're lucky if they can go September and October on that same 4-month schedule of fees. But as I was saying with regards to the student loans and the fact that they're acquiring student loans, when they go in to register in the second half of the year, many students do not have the money. And I'm sure any of my colleagues from Cape Breton would certainly attest to the fact that literally hundreds of students in the last year, I believe, there have been upwards of 500 students, perhaps more, given notice that because they weren't able to pay their registration fee for the second part of the calendar year, or the school year, the university year, that they would have to vacate the university. So here they are with a student loan that obviously they don't have a job. It's not enough for them to be able to complete the year, so they're going to be disadvantaged because unless they're able to come up with another source of revenue, Madam Speaker, then they're out. And what do they have to show for it? And that happens year in and year out at this particular university. I'm not so sure how prevalent it is across the province. Perhaps the Minister of Education could speak to that particular issue, but it is a growing concern for the young people in Nova Scotia. And because of that, Mr. Speaker, there's a considerable brain drain out of the province. The government, and perhaps previous governments too, that's open for debate, has considered university education as a cost. It's a budgetary matter, and I can appreciate the fact that the government has to deal with the bottom line at the end of the day. But more importantly, Madam Speaker, university education is an investment. It's an investment into the future of this province. And we have to change our focus. We have to get our head around the fact that so many young people are leaving this province because they can't cope with that debt. And many students that do get a university here in Nova Scotia are leaving because of better opportunities with bigger pay to be able to pay their bills. They can't stay. It's just not there. And I'm sure that issue also applies to the community college system, but not to the same extent. And that evidence has been certainly put before members of one of our legislative committees within the last year. So, Madam Speaker, that is an issue of concern. Last year, we were fortunate enough, or earlier this year, we with the government's support, and certainly with considerable input from the Department of Education, the minister's staff, and so on, and approbation from all three caucuses, we adopted the Youth Secretariat Act. What has the government done to advance the causes of the young people in this province, particularly as it relates to university education, their careers, student debt load, the brain drain from the province, all the issues, all the social issues that are befronting the young people of Nova Scotia? What is the government doing? And how can the Higher Education Commission play an active role, a leadership role on this particular matter, Madam Speaker? These perhaps are questions. I know that the mandate for the Higher Education Commission is clearly laid out, and this particular piece of legislation is an amendment, refocusing, so to speak, but there's a much broader responsibility. We not only have a legal responsibility, but we have a moral responsibility, Madam Speaker, to these young people. You know, it's been often stated that the future is the prosperity of tomorrow. And how we treat that, the youth, rather, is our future. If we treat them badly, and then we have more social problems in the years to come, whether it be in education, whether it be in health care, or what have you, Madam Speaker, we have no one to blame but ourselves. We cannot point the fingers at the next generation, because we have to provide them the leadership and the opportunity to do what is in the best interest of this province in years to come. I wanted to raise those points, Madam Speaker, because they're very important. The Minister of Education, who is the minister responsible for the Youth Secretariat Act, we were successful in taking that responsibility, having the youth being tossed around as orphans in the system between 6 or 7 different government departments, and with a clearly defined mandate under the authority of one particular department to be able to allow them to take a leadership role on the issues of tomorrow. And I would hope, after the first year has passed, that the Minister of Education will be able to stand proudly in this House and table the first annual report from the youth of this province through the Youth Secretariat Act and the Youth Secretariat. Mr. Speaker, we owe it to the young people of this province. How many times have we heard the Minister of Education, the Minister of Health, the Minister of Economic Development, former ministers stand and boast so proudly about the young people in the province and all their accomplishments. Day in and day out, Madam Speaker, we introduce resolutions congratulating our students on all their accomplishments in education, you know, in particular awards, you know, and scholarships and extracurricular activity awards and so on. But, Madam Speaker, we owe it to them in a much greater way than just words. Actions speak louder than words. You know, Madam Speaker, we have, every year, we are so fortunate to have some very bright and talented and vibrant young individuals come and work in this House of Assembly, every other House of Assembly across this country, indeed in the House of Parliament, to sensitize themselves to the realities of how public life, how public policy and government impacts on themselves. And they use this as an opportunity to better themselves, not only academically, but holistically as citizens on how to be the leaders of tomorrow. Well, Madam Speaker, it's not just good enough, you know, to recognize in that fashion and to help them, which is very important. For example, with the Nova Scotia Summer Employment Program for students, particularly for university students. What happened to that? That has been watered down. If it gets watered down anymore, Madam Speaker, it wouldn't even qualify as a puddle. I mean, at one time, it was a very active and very successful program in helping students. And yes, there is some mentorship type program still within each different department, but it's only a fraction. It's only a fraction of what it used to be. So the government has to again change its mindset on the cost of education. It's not a cost, it's an investment. If we expect the students of this province, whether it be through the Higher Education Commission, whether it be through the Department of Education, whether it be through the Youth Secretariat Act, or whatever agency, public or private, it doesn't matter. We have to understand, we can't expect them to consider that only the cost of education, only the cost of being able to work their way through the system is their responsibility. And then when they get out, we can't wait to get them into the marketplace, to the workforce, and tax them to the bone. They can't do it. It's getting more and more and more difficult. And I'm sure every member in this House can speak to that. They know constituents. They're going before the Student Aid Board. I know our office deals with it on a daily basis, particularly between, I would suggest, August and January. They're particularly September and October. And the minister, I'm sure, has the same level of concerns and complaints coming in. Some of them are valid, some of them are, somewhat technical in nature because forms haven't been properly filled out, or the parents haven't provided the sufficient detail or whatever. But it's becoming so bureaucratic and so cumbersome, Madam Speaker, that it's almost like the faint hope clause to get to the